the fifth leading cause of death. I'm Kelly Moroso, and I'm here to give you the latest scoop on breast cancer detection. It is estimated that 1 out of 8 women will develop breast cancer. We will talk with a doctor about early detection and also hear from 2 twin sisters about how breast cancer has affected their life. With that, we will turn it over to Jomi.
Thanks, Kelly. My name is Jomi Reddings, and I'm sitting here today with Dr. Lopez, a very distinguished doctor that works for our general hospital, is it?
Yes.
Very nice to meet you today.
Nice to meet you, thank you.
Okay, what is it? Can you tell us about breast cancer prevention?
Okay, so we know that breast cancer is a very big topic when we refer to women's health, and the most important thing in breast cancer is early detection. Okay, we know that women, 80% of them that develop breast cancer do not have a family history of breast cancer. Okay, so the most important thing is to teach our patients about early detection. The first thing they could do is self-breast exam starting at the age of 18. They could do that monthly, 7 to 10 days after their menstrual cycle, and they will do that on their own, or they could come to the healthcare provider who will perform the breast exam for them yearly. Also, the next thing we have mammograms. Okay, with mammograms, they should start at the age of 40 and do that yearly. A mammogram is basically an x-ray of your breast, and it will show the inside of a breast where the cancer starts developing. Now we have a diagnostic mammogram, and then we have a screening one. The screening mammogram is you don't necessarily need to feel a lump or have any symptoms of cancer. Just come in and have the mammogram, because that screening mammogram will show is your breast and see if there's any cancer that has not developed enough for you to feel it. Okay, and then we have the diagnostic mammogram that one is done yearly also, and that mammogram will show a cancer that usually has developed and you are already showing symptoms of it. Like I say, early prevention is the most important thing, so remember women's early prevention. Go talk to your doctor.
Thank you very much. And from here on out, we're going to pass it to Pamela.
My name is Pamela, and I'm here with twins Chelsea and Kelsey, and they're going to tell us about their story about how breast cancer has affected their lives.
So I'm Chelsea, and I found out that I had breast cancer when I was 45, and one morning I just noticed that I had a lump, and it made me really nervous because, you know, it really hurt, and I wasn't sure if I had pulled a muscle or if it was something else. And so after going through different exams with the doctor, they did a biopsy, and I found out that I had breast cancer. And the scary thing was, you know, I'd never heard of anybody in my family having breast cancer before, so it was totally unexpected. And so I had to have an operation done to remove the tumor, and we're just hoping that that took care of the problem. But she's really nervous about herself and about her family. So.
Okay, so now we will introduce Kelsey, her sister.
Hi, nice to meet you.
Hi, nice to meet you. Tell us your story.
So I'm Kelsey, and I have just been so nervous when I found out that my sister got breast cancer. I just cried so much because it just scares me that the possibility of me getting breast cancer has dramatically increased, and I never even knew that I was at risk for breast cancer. I never knew that it was important to be doing those breast exams. So
maybe we should get you to speak to Dr. Lopez.
yeah, I would like that.
Thank you for sharing your story with us, Kelsey. Now back to you, Kelly.
Okay, and next up, the oil spill hits Fort Lauderdale Beach. Stay tuned.
My name is Joey Reddings with CBS4. Oh, I'm sorry. So what can you tell us about, yeah, no.
And now, you know, I'm learning new things, and